folks. We have Saket on remote on Zoom call here. Saket is the medical lead for drug and alcohol policy in Glasgow Council. So apologies for the slight technical problems there, but Saket's now going to present some slides and a presentation on safe consumption rules. The pilot scheme is hopefully attained for next summer in Glasgow, but I'll hand you over to Saket now. Thanks very much.
Okay, good afternoon everybody. Hello from not very sunny Glasgow. I'm sorry I can't be with you in Belfast, but many thanks to you for the invitation to speak and time on the agenda today. Can we go to the first slide, please?
We're on it.
So I'm here to tell you about our plans to implement a safer drug consumption facility in Glasgow City. I'm speaking on behalf of my colleagues in the Glasgow Alcohol and Drug Partnership and in the Glasgow Health and Social Care Partnership. What I thought I'd do today is give you a little bit of background to our proposal for a safer drug consumption facility in the city, and to explain by setting the scene as to what's happening in Glasgow just now in 2023, why it's an important proposal for the city as ever. I'm going to take the opportunity to explain to you what a safer drug consumption facility is and what the legal framework that we're hoping to secure to allow us to deliver that service will look like. And then I'll end with just telling you a little bit more about the service and also the governance arrangements that we have in place to help us implement this as safely and effectively as possible. So the proposal for a drug consumption facility in Glasgow really stems from us understanding some of the drivers to an outbreak of HIV in people who inject drugs in Glasgow City. We saw an outbreak, a large number of cases in 2015 in the city after more than a decade of fairly good control of HIV in this population. And unfortunately, from 2015 onwards, there continued to be a rise up to a peak of a 10-fold rise in prevalence of HIV among people who inject drugs in Glasgow City. And although that numbers of new HIV results have reduced in recent times, we thought it very important to investigate the key drivers behind this. So next slide, please, Damien. And can you just tell me which slide you're on? You should be moving to slide 4 now.
4? Okay. You need to let me know just a wee bit in advance. Just shout out loud, very loud, just slide 1, 2, 3. So you should be on 4?
4, yes, please.
Okay.
The heading should be Health Needs.
That's the one.
Okay, thank you very much. So we conducted a health needs assessment of people who inject drugs and who are HIV positive in 2015, and we found that a large proportion of them were involved in injecting in public places in the city. That population we measured as being about 400 to 500, particularly concentrated in the city centre, and they had a high proportion of living with multiple bloodborne viruses, HIV, hepatitis C, and a whole range of other drug-related harms. They had severe and multiple disadvantages and complex needs, and that formal health needs assessment, which you can find quite easily on the internet, it's called Taking Away the Chaos. That health needs assessment made recommendations about improving our current services for that population, but also implementing new services such as heroin-assisted treatment and a safer drug consumption facility. Unfortunately, we were unable, even though our proposals to implement these services was approved by the Glasgow City Integrated Joint Board in 2017, we were unable to implement a safer drug consumption facility at the time because we didn't secure a legal framework to do so. So a safer drug consumption facility is a place where people can bring their own drugs and consume them under supervision of trained staff. But in order for them to exist, there needs to be a legal framework that would allow people to possess drugs in such a facility. Heroin-assisted treatment did not require a legal framework, a new legal framework, because by licensing we were able to deliver this without new permissions. And therefore in 2019, in December 2019, we established a new service in the city called the Enhanced Drug Treatment Service, EDTS, which allowed us to prescribe heroin to this population. But unfortunately, we did not secure the legal permissions to allow us at that time to implement a safer drug consumption facility. And unfortunately, the public health issues related with injecting away from home continued. Next slide, please, Damien.
That's you.
So, as you can see from this graph, 2015 actually saw a rise in a whole number of drug-related harms in the city, including drug-related deaths, which started to rise steeply that year. So the blue boxes are each individual year's number of drug-related deaths just in Glasgow City alone. And you can see that rise peaked, we hope, in 2021 at over 300 deaths just in the city alone. And of course, this coincided with the national public health emergency in relation to drug-related deaths. Although we've seen a very steep reduction in 2022, which was very promising, unfortunately this year already in 2023, we've seen projections of another rise in drug-related deaths. And so a public health emergency into problem drug use continues. Next slide, please. We've also looked at where people inject, and we asked them this from our injecting equipment providers, and that tells us that even for a 6-month period between 22 and 23, so very recent data, the large proportion, most injecting drug use happens away from home. And those sites can be sites such as squats, abandoned houses, public toilets, stairwells, closes, car parks, outdoor spaces such as parks, alleyways, and streets. Next slide, please.
There you go.
When we look at needle complaints to the City Council, we can see that actually the city experiences a very large number of public injecting sites in the city. So the largest, the purple circle there, is the hotspot of public injecting, which happens in the southeast quadrant of Glasgow city centre. And the red cross in the right is this proposed site of the safer drug consumption facility. And it's less than a 10-minute walk from the hotspot to the new site. The site itself has multiple public injecting sites around it, as can be seen by the relatively smaller dots. Next slide, please, Amy.
There you go.
So we should be on slide 8. And on this slide, you can see what one of the larger injecting sites in the city looks like. So you can see why this would be a very unhygienic and unsafe place to use drugs. So injecting away from home is increasing, and some of this is driven by changing in drug use trends in the city. So unfortunately, we've seen injection of cocaine use rising and becoming very prevalent. And so a number of public health issues are emerging and continue even in 2023. Next slide, please. So we were very pleased when a new Lord Advocate for Scotland in 2021 made an announcement in the Scottish Parliament, Dorothy Bain, that she would look at a fresh, new, precise and specific proposal for a drug consumption room in Scotland. We were then invited by the Scottish Government to participate in a national working group to develop a proposal that the Lord Advocate might consider. That national working group involved colleagues from Crown Office, from Police Scotland, and from the government itself. Next slide, please. So we're moving on to slide 10 now. The new proposal required to be one that could be delivered with no change required to the Misuse of Drugs Act 1971. In essence, the Misuse of Drugs Act 1971 is not devolved to the Scottish Parliament and is a reserved act to Westminster, and there was no support in Westminster to make the legislative changes required. This meant that our standard operating procedures and our service specification needed to mitigate for any potential breaches of risk, any potential breaches of the law of the Misuse of Drugs Act in particular. And we were able to work through most of this, but what we required from the Lord Advocate was a statement of prosecution policy so that service users could bring their own drugs without fear of prosecution to such a centre. And on the 11th of September 2023, just 6 or so weeks ago, the Lord Advocate made a public announcement that she would be prepared to issue a statement of prosecution policy based on the service specification and details that she had seen from us, but also if the service was subject to a robust evaluation and we underwent a period of engagement with communities and residents nearby. Next slide, please. So what is a safer drug consumption facility? On to slide 12. Safer drug consumption facilities are also known as safer injecting facilities or drug consumption rooms, and more recently as overdose prevention centres or sites. They are sanctioned hygienic environments where illicit drugs purchased off the premises can be consumed under clinical supervision. They're usually sterile injecting equipment can be provided, as well as staff being able to advise on injecting technique. Crucially, overdose assistance is on hand through trained staff, and most models of safer drug consumption facilities include on-site health and social services to support people's wider needs, such as drug treatment, housing, and benefits. The photos here are from the sites from services in Vancouver and Sydney. Next slide, please. However, most of the services that exist in Northern Europe. There are over 100 of such facilities across the world. Next slide, please. And the evidence from these facilities tell us, and if you just press one advanced button, that the evidence for benefits to service users are that these services engage people who use drugs in the vicinity of these facilities. They reduce drug-related harms in this population. They reduce infectious disease transmission. There have been no overdose deaths in any such facilities across the world. And so for people who use these facilities, they've been shown to reduce drug-related deaths. They increase access to treatment, care, and support services, and we think they will contribute to reducing stigma and, of course, giving people some dignity and hope. Next, our press.
Yep.
For benefits for the communities and society, there are benefits through the reduced drug-related litter and visible drug use. So there's improved social amenity for those who live and work around these sites. They are proven to be cost-effective, particularly because they leads to reductions in costs elsewhere in the health, social care, and criminal justice systems. Importantly, the evidence from across the world tell us that they don't have a honeypot effect. People don't travel large distances with drugs on them. And they neither increase nor reduce crime in the vicinity of these facilities. Next slide, please. So I'm going to tell you a little bit more about the specifics of the Glasgow City Plan. I showed you the location of the service. It's in our health and social care, homelessness health and social care building at Hunter Street, just in the east of Glasgow City Centre, and it'll be located with a whole range of other services that this population will require. So services such as drug treatment services, including our heroin-assisted treatment service, services such as blood-borne virus, sexual reproductive health, housing, and access to welfare rights as well. And we will have primary care and mental health workers in the building as well. We plan to operate 7 days a week, 365 days a year. At the moment, the plans are to operate 9 a.m. to 9 p.m., but we'll review that as we go on. The service will have as low a threshold as possible, and really at the moment, the only inclusion criteria that we're working to is an age over 18 and injecting drug use. But of course, the service is targeted at a population that we know quite well, a population of chronic older drug users who've got a long history of injecting heroin and more recently cocaine. I'm going to talk about the model of operations by talking you through the next slide, please, which is slide 16 now. And this should show you the plan of this is an early draft plan. There's already been a few changes, but I've just kept this plan for the purposes of showing you the principles of the service. So people will present to the services themselves. They don't need referred. There'll be a reception area where on their first visit, we'll ask our service users to register, and they can register for the service using an anonymous ID number. They'll speak to somebody who'll discuss what drugs that they've brought, what drugs they're planning to use and how. And then they'll go through, once the booths become available, into the consumption area where they will be able to inject their drugs under the supervision of nurses. The nurses will provide them with equipment, but not be involved in the actual injecting process themselves. The nurses will be there to respond to any problems that arise and to advise on safe injecting techniques. Should people need wound care, blood-borne virus testing, or any other health issues that arise, there are treatment rooms available to see people in a confidential manner. After they've used their drugs, they move to a recovery area where they will stay until they've recovered from the immediate effects and any significant risks from their drug use. And then we will hope that people will spend time in an aftercare area, which will be a much less clinical area where they will have the opportunity to stay, have a cup of tea, coffee in a warm, well-lit environment where we will have staff to engage them with offers of drug treatment, housing, benefit improvement, and any other services and supports they need, including peer workers as well. And people will leave that service then from the exit, and it may be that some people will use this service more than once a day, as is typical in the rest of the world. Next slide, please. Slide 17. So these are the injecting booths that we already have in Glasgow City at our heroin-assisted treatment service, the enhanced drug treatment service, and we expect the injecting booth area of the new safer drug consumption facility to look not too dissimilar to this. very clinical, very clean, very hygienic, well-lit places. Next slide, please. This is the reception area of the Simon Community Hub, homelessness hub in Glasgow City, with one of our key third sector partners has opened and run very successfully in the city. And I'm just using the picture of the reception area to show a warm, psychologically informed, trauma-informed place, which is what I hope that our aftercare area will look like, the sort of space where people will feel comfortable in staying for a while, and very different from the sort of more cold and clinical space that we need the injecting area to be. Next slide, please. So just to conclude, I'll just tell you where we are in terms of our governance and our current plans for engagement and evaluation. So next slide, which should be slide 20. So the Integrated Joint Board approved our plans to move to an implementation phase. So we now have an implementation board, which is chaired by 2 of our assistant chief officers. We have a number of work groups, and these are on communications and engagement, property development, workforce, and evaluation. The Lord Advocate was clear that she wanted to see good engagement with communities and businesses, and that she wanted a robust evaluation plan to accompany the proposal. So at this moment in time, our focus is particularly on getting the property right and in engaging with communities, residents, and other communities, businesses, and other stakeholders, particularly those in the vicinity of the site of where the drug consumption facility is to be located. Next slide. To support the engagement, we've developed a number of resources that for the public, such as a frequently asked questionnaire document. We're about to publish our bespoke Safer Drug Consumption Facility webpage, and we will have, which will have links to videos of other facilities in the world and more information about the site. So at this moment in time, I can tell you we're very involved in the engagement and answering the public's queries. But I suspect, next slide please, that you may yourselves have questions, and I'd be very happy to try and answer them and be involved in any discussions afterwards. So next slide please. Thank you very much for listening to this. If you have any questions, then get in touch with us at adp@glasgow.gov.uk if you have any queries that I'm not able to answer immediately. Thanks very much.
Thank you.
Saket, thanks very much for the very thought-provoking presentation there. I'm just going to open that up to the floor. Just before I do so, you've clearly alluded to a lot of the benefits in terms of safe consumption rooms, in terms of sort of there's no increase in crime rate, there's a clean area around. There has been some kickback, so it's been a bit of a topic within the council here. There has been some kickback from some political parties regarding the downside of such areas. Can you speak to some of those objections?
Yeah, so I mean, if we're considering potential downsides, I think it's not very difficult to imagine what they might be. So in our engagement with the communities and with businesses already, we're seeing some recurrent themes. Can you hear me okay?
Yep.
So some of the recurrent themes are really around what the policing strategy around such a facility will be, around whether there's any risks of people traveling large distances to come to them, whether they'll be dealing and criminality in the immediate vicinity of these sites, and how all that will be managed so that any risks for residents and businesses locally are well managed. So the evidence around the world, again, if I can reiterate, tells us that actually people don't travel large distances with drugs on them. So we anticipate that really our target population in terms of the use of this facility are really going to be people who are already in that community at this moment in time, who aren't traveling. They won't travel large distances. They won't get on buses and trains to come to this. It'll be people who can get here quite quickly on foot. So we don't anticipate seeing larger number of people coming into the community. We are working with our police colleagues around what their policing strategy will be, and I can't speak for Police Scotland, but from what I'm hearing, they are basically going to manage this service similar to as they manage any streets and services in the city. So we have a number of injecting equipment providers and drug services already in the city. This building already hosts a number of services that this population uses, and people are coming to and from this building already without any significant complaints or concerns from the public. So we'll work in partnership with the police around this as well. But also what we're hearing is that across the world, there are really good models of how the service, as well as local communities and businesses, work together to keep in touch and to monitor the impact of this on the public, and then to implement actions required to mitigate any of the problems as they arise. So we're looking at the best models of practice in relation to that, so we can work with the local community to actually realize some of the benefits of this for them, and ensure that some of the fears aren't realized. But there isn't, we can't guarantee anything. There's an evaluation that comes with this, a totally robust and independent evaluation led by academics, and that will tell us how successful we have been in this endeavour.
Thanks very much. I can see Alison appearing on screen. I'm not sure if she can hear us or we can hear her, but we'll try anyway.
I can hear you, yeah. Can you hear me okay?
Brilliant. The power of technology. Thanks very much. Alison, thanks for joining us. Did you catch much of Saket? Well, I'm sure you've heard Saket's presentation before. We made it very clear in terms of the positive benefits of safe consumption rooms. I wonder if you could just add from your own perspective.
Sure, and I absolutely thank you very much for having me along today. And Saket and his team have done amazing work on this over many, many years, pursuing this as a public health issue. I suppose to let people know the perspective that I have come at this from has been as a local elected member in the East End of Glasgow. So I was first elected as a local councillor in 2007, and I remember really clearly one of the early times we were out campaigning in the Calton, a man going to me, here Alison, come see this, and took me over to the swing park where there was discarded needles next to one of the bins in the children's playground. And from that point until now, the issue of discarded needles in this part of the town has never gone away, and in many aspects has got worse. So I started at it from that perspective of this is a real difficulty for many of my constituents. They're seeing people injecting behind their houses, in lanes, in bin shelters, on waste ground and all of these places. And there's nowhere for anybody injecting to go, nowhere safe that they can go and do that. And the kind of logic of having a drugs consumption room is absolutely there as far as I'm concerned, because it gives people that ability to go into a facility where they will be looked after, where they will be cared for, where they will have access to medical support, which just doesn't exist, cannot exist at the present time, and has not existed. But having seen ones in other countries and how they operate, you can really see the opportunities that gives to engage with this population who don't feel safe, don't feel looked after, they don't feel cared for, they feel very alone and quite separate from the rest of the life of the city. And there's kind of multiple impacts of that. People are injecting in really dirty situations. they're injecting very quickly in the cold, in the wet, and the rain. That has an impact on their health. There's a basic issue of dignity there as well. And I think that having such a facility would make a massive difference in terms of just how that population are supported, and also how the population out there in the community feel about drug injecting. And it's been interesting actually since the most recent proposal for the go-ahead for this facility. I have constituents in touch going, "This is terrible, this facility is causing all this harm." I'm like, the facility hasn't opened yet. The reason why somebody's injecting behind your house right now is because there isn't anywhere else for them to go. And there's been this problem over the years that while the imperative to hand out clean needles is really important, the service was just handing out a needle to somebody who was then going around to the bin sheds behind the facility to do that injecting. So it moves to a more joined up, comprehensive type of service by having this kind of thing. And I just wanted to touch just a little bit on the kind of wider impact on the community. So Venue Housing Association is one of the biggest housing associations in the East End, and they wanted to build a new housing facility. And the number of needles discarded on the ground that they wanted to build this housing on was such that they had to get the entire area of topsoil removed and sent to specialist disposal before they could even lay a brick in the ground. So there's a huge cost involved in not acting and not doing something as well, and that's a cost that is borne by the community, it's a cost that's borne by housing associations, it's a cost that's borne by the council, because somebody has to go around and pick up all these discarded needles. And there is a risk for those doing that as well. So I think moving to a situation where those needles don't even have to leave a facility, they can be used safely indoors in medical facilities is also that massive step forward. And I just wanted to mention just as well that the agenda in Scotland has changed significantly over the years as well on drugs more generally and on injecting facilities specifically. So when I first started to talk to colleagues about this, nobody wanted to touch this in a political sense. Drugs were the kind of third rail. Nobody wanted to be seen in any way as being soft on drugs. That's still very much the Westminster agenda, but in Scotland things have changed quite significantly on that. The Health and Social Care Partnerships proposals for drug consumption changed that significantly, because here was a public health body buying into this agenda and saying this is what we need to do. We need to tackle this bloodborne virus outbreak. We need this kind of facility that has worked in other countries. What also helped change the narrative was newspapers like the Daily Record, which is Scotland's main tabloid newspaper, who came on board with this proposal as well. And having a tabloid newspaper advocating for this facility also changed this quite dramatically as well, because it then wasn't the pursuit of a very narrow group of people trying to do something. It was the pursuit of the public and the voice of the public in that as well. And they were able to tell a lot of the stories of people who would benefit from this facility, people who had lost loved ones because there was no such facility, and seeing what a difference that this could potentially make. So from all of those kinds of aspects, I think the public health debate has changed, and it's very encouraging that Scotland will now be able to go ahead and pilot this initial facility. I would like to see other such facilities coming along, because they are important, they are needed, and we've seen in other countries that they do work. So I'm happy to leave that at that, and I don't know if people are having questions or other things they want to raise with us as well.
I think just in terms of what you said, it's a key sort of presentation has been very clear about the benefits of such facilities. But is it fair to say that maybe the two biggest obstacles, the drug policy and the records, sort of evidence around the world suggests that they are of benefit, but will be the two biggest obstacles being the stigma attached to people struggling with addiction, and also the legislator? Is that fair, Alison?
So I think there are definitely issues about stigma and people getting into treatment and people coming into services. But the kind of main barrier, which has been a huge frustration for me, is the Misuse of Drugs Act, which is woefully outdated as a piece of legislation. It doesn't work, and it actively puts people at harm. And I didn't catch if Saket had said this in his presentation, but under the Misuse of Drugs Act, there could be a risk of those operating the facility, those using the facility, those working in the facility, the corporate body that owns the facility being prosecuted under the Misuse of Drugs Act. So the Ward Advocate's ruling on this is really important. But there's also been, intransigence for these past 7-8 years from the UK government on this. They could have legislated, they could have made an amendment to the legislation to allow for this to go ahead. And I'm always very mindful of the people whose lives could have been saved had this moved from the UK government's point of view just that bit faster.
So I'm just going to open the floor if anybody has any questions. I think Stanley Dudley, the MLA, is just asking, do we have any evidence that people using the facilities go into recovery programs? Is that really what you're aiming at, Danny? Do we have any evidence from sort of other countries that is the case, that people go from the use of the facilities into recovery programs?
So what we know is that if they're sited in the right place, then they will be used. And we know that one of the things that's clear about them is that people who use those services will use them as a springboard for engagement with other services, including drug treatment services and a whole range of other health improvement services. So if that's what's meant by recovery in the question, then yes, in that widest definition of recovery and improving your circumstances and your health and the control of your drug use, then yes, people do engage with that. If the question is recovery in the the abstinence end of the discussion, then there's very little evidence from the international literature that these services achieve that, not because they don't. It's because that question is not really asked very much in the research literature from around the world. The literature really focuses on improving life circumstances, improving public health outcomes.
Thank you, Saket.
Hi, Alison Thelwiss, Kevin Bailey from the Public Health Agency. I'm wondering, could you say a little bit about, one, the workforce model, and two, the funding model that's intended?
Sorry, did you catch that, Saket? We're looking at the funding model and also the workforce model.
Could you repeat that? I'm really sorry, there's quite an echo.
Yeah, sorry, apologies, we've had a few difficulties with the IT here, just in terms of the internet. So we've Kevin Bailey from our Public Health Agency. Kevin's basically asking, in terms of the workforce, what would that look like? And also,
The funding
where would the funding for such come from?
Yeah, so the workforce question. So there are many different models across the world that you can deliver this through. So for example, I know that in some parts of Europe that have had these services for a long time, people who are actually either have used the services in the past or even our current users are involved in the workforce that deliver these services. In other parts of the world, third sector organizations deliver these services. But for us in Glasgow, we're delivering this through Health and Social Care Partnership. So the bulk of the staff will be NHS or Glasgow City Council employees. We'll have a multidisciplinary team there. So the nurses in particular will be the key to the injecting area staffing. So that's where the clinical role comes in. But we'll have social care staff to support people in their care planning and assessment of wider needs and the harm reduction work that they need. And our staffing complement also includes peer support worker as well, to try and help people link into the wider recovery networks, recovery in the widest sense, networks that exist across the city. We've got psychology and medicine there as well. They're sort of single posts really about providing additional components to the core staffing group. So it's quite a multidisciplinary team, but delivered through the statutory NHS and City Council structures and delivered through the Health and Social Care Partnership. So it's quite, so you understand fully that it's quite an expensive model compared to other models So third sector models tend to be cheaper, and then obviously those that involve volunteers and drug user associations themselves might be even sort of cheaper still. But as this is the first one in the UK, we're trying to deliver one that is as robust and as safely governed as possible at this moment in time. But I very much would hope that in time we could look at different models of delivery.
You said
I just wanted to add to that just quickly. In speaking to some of the staff that work for the Enhanced Drug Treatment Service, the Heroin Assisted Treatment Service, it was really quite striking that they were saying how glad they were to be working in this kind of service, how much they felt as though they were being the work was of value and something that they've always wanted to do. And I think that's quite interesting in how you attract people to the service, because you feel as though you can actually make that bit more of a difference. You move from a service that kind of hands out needles to a service that helps people out with their issues in a more meaningful and grounded way than that. So I think that was quite interesting, hearing how the staff experience of this small bit of service that already exists has been.
So you just alluded that it can be quite an expensive initial setup. So you have that expense on one side, but on the other side, almost coming out the exit door, is the benefits in terms of the cost of the health service, the cost of the criminal justice service as well. And Kevin's second point was just in terms of the actual funding for the project in general. That's kind of been answered as well. So listen, thanks very much. Is there anybody else with any other questions? Oh, just one more, sorry. Bear with us, sorry.
Thanks very much. Colin McGrath, SDLP, MLA, and I suppose maybe my question was for Alison in terms of gathering political support for a project like this. You referenced some of the local objections that there can be from residents, but in terms of trying to get legislation or cross-party support, given that certainly here in the north we have a very vibrant right-wing approach to some policies, and it can be difficult to try and get cross-party support. So maybe just if Alison was able to explain some of the work that she had done to get that political buy-in from across the spectrum.
Did you catch that, Alison?
Yeah, I did. Thank you, and I appreciate the cross-party support and the difficulties that you may have in achieving that for different reasons. But I think there are, first of all, there's different arguments that can be made depending on who is listening to that argument. Is it a cost-saving measure? Because it will save public bodies money if they're not turning up in an ambulance. They can actually have a proper service and look after people. That's an awful lot cheaper in terms of how that person's experience is managed. Having bloodborne viruses for your whole life is very expensive to manage. If you can get in early, you can prevent, you can treat. That's really important. But in terms of Glasgow, so when the initial proposal was brought forward by the Health and Social Care Partnership, that was done under a Labour Council, and I was very keen to be supporting that Labour Council move on a cross-party basis, because that helps then to cement that agenda in place. And I'm more than happy to work with anybody that supports this proposal to make sure that it gets across the line. There was some initial support from the Conservatives in the council around that. That has wavered a little bit over the years, but we're pretty solid in terms of the political support in the council, in the Scottish Government, and within our group at Westminster as well, in seeing that this is an important proposal for public health. And when you frame it in that public health term rather than criminal justice situation, I think that becomes slightly more easy to support as well, because it is about people and their health and well-being and the impact on their families. So we can talk about it in that way as well. And just to touch, I suppose, on the community side of things, yes, there's a lot of hesitation, there's a lot of nervousness among members of the community as to what this will mean for them. And we had a public meeting on this, and there's some very strongly held views on it. But when I speak to those members of the community individually and say, well, this is what it is, and this is what it isn't, and this is what we're trying to achieve by doing that, you can actually have those individual conversations, and that does work with people. Public meetings are always the best forums for these kinds of discussions, but individually those people are coming on board with this, because the current status quo with needles everywhere and people injecting and the harm that causes everybody There's definitely an argument to be made there that this is something worth trying. We haven't done this before. Let's see how this works. And it is a pilot and it will be evaluated.
Just check when the trial is actually due to start, next summer?
Yeah, next summer, hopefully all things going well.
Good luck with it, good luck. So any other questions? Alison, that's okay. I thank you very much for joining. That's been a very engrossing conversation. Hopefully, people have suggested that should be an annual conference. We'd very much like to have you back again, maybe in person next time, once you get sort of the initial findings from the pilot scheme. But can I thank you again very, very much. Alison, could you also thank Mary in your office for her help in helping us, and also she actually suggested your good self, Saket. In terms of the presentation, she said you would be a star, which is both have been. So thank you very much.
Bye.
Thanks.